Good morning, everyone. Thanks for joining us. Welcome to Virtual Teal on the Hill. It's a little strange not seeing everyone today, and I'm certainly sad that we couldn't all be together, but glad that we came together virtually so that we can still continue to advocate on behalf of those people with Spina Bifida. As we are living in strange times these days, things like Virtual Teal on the Hill are very important to us and to our community. They help keep us connected to our cause and to what we're trying to do. And that's, pardon me, never more important than it is right at this point in time. I just wanted to start off by welcoming everyone today. Thanks for taking time out to join us and be a part of today and our training for tomorrow's activities. While we would love to be out tromping through the rain tomorrow here in DC on the Hill, we'd be going into empty offices at this point in time. So I guess we're going to do it the best way we know how, which is Plan B. And thank you for being part of that. Before we get started, I wanted to start by just giving you a little information. Just so you know, we had over 300 people register for today's webinar. They represent 43 different states and 5 different countries. So I'm so glad that so many people decided to join us, and currently we have about 130 people who have logged on, but we are recording this, and so everybody who signed up will be getting a link to this recording so that they can view it in their own time. And I'm sure we'll have people drop in and drop out throughout the entire day. So just to kind of give you a little bit of information about what's going on today, we've got a series of presentations set up. I'm sure everybody's taken a look at the agenda. But basically, we're trying to do about 30-minute presentations and leave about 15 minutes for Q&A afterwards. And how we'll do the Q&A is, if you look down on the bottom of your screen, next to the icon that says participants, there's a Q&A feature. Please put all your questions there. We have disabled the chat for this particular webinar today because, quite honestly, it's really hard to kind of go between the chat and the Q&A and get questions answered for people. And so if everybody can concentrate on the Q&A, the chat feature will only come to us, so you won't be chatting with one another. And that is really, if you're having a technical difficulty, you can use that if you'd like. But otherwise, please just concentrate on the Q&A session, Q&A icon, and use that for your questions for us. And I'll do my best to try to answer all of those questions, or to have our to get them to our presenters and have them answer those. But if we don't get to all of them, we'll be posting any pertinent questions on the website after this. Before we get started, I'd also like to thank our sponsors for today, Smith & Nephew. They came in as our blue sponsors. And for our silver sponsors, it's 180 Medical, Avion Pharmaceuticals, and Hollister. We couldn't put on this presentation without them, and so we really do appreciate that. And later today, or later this week, probably not today, tomorrow, or a couple of days later, the recording for this will be put up on our website, so that on the Teal on the Hill pages, so that way you can go back and refresh your memory if you'd like to. And we will be going through today during our agenda. We will be going over what our next steps are at the end of the presentations today. Before we get started, I thought I would just kind of briefly run over today's agenda for us. We're going to start, I'm going to give you a little bit of an update of what's going on in SBA these days. Then our friend Julie Himes, who works with us on all of our policy issues from Fagery, Drinker Biddle, and the district policy group, will be giving us a little update on the congressional scene and the appropriations process. That will be followed by a lunch break in which we'll have a presentation by Paul Seltman, the Senior Vice President of Public Policy and Government Affairs at Smith & Nephew. And we're also going to award our Tom Baroque Advocacy Award during our lunch break. 1 to 2 o'clock, Megan and Will, who are co-chairs of our advisory council, will be giving us a presentation on our advocacy priorities. And we have left plenty of time so that you guys can ask any questions that you'd like to during that, or we're hoping to get to as many of them as possible. And then at 2 o'clock, a couple of really special people, John Weiner and Robin Bowman, two physicians who are part of the National Spina Bifida Patient Registry group, will be giving us an update on what's going on with the registry. We'll take a break after that, and then Nora will give us, will lead us on a session of finding your story, about telling your story when you're talking to people on the Hill. And then we will have a presentation from Nick Slope, who is our consultant at One Click Politics, who will talk about the software that we use and how we're going to use it for this. And then Sheila Roy, our Chief Operating Officer, will wrap things up and talk about what our next steps are. So that's how we have our day scheduled today. If all goes well, we'll get you finished before the 5 o'clock hour. And a lot of it will depend on how many questions we have and how complicated answers have to get. But hopefully we'll be able to do this in a meaningful way. Please feel free, if you need to get up and move around. You know, don't think that you have to sit in front of your screen this entire time. If you need to jump off and do something else, feel free to do that, but please come back to us so that we can kind of round out the day. Otherwise, we'll be talking with you throughout the day about a variety of issues, and if you have questions, please just feel free to ask in the Q&A feature. All right, with that, we'll get started with our Spina Bifida Association update. So when we started down this road, it was a much different world than we're in these days. And COVID-19 has kind of taken over our life, and we realize that. But we are still focused on one thing and one thing only, and that is our mission. It's a new mission for us. We just crafted it at the end of last year. It was passed by the board of directors. It was based on a lot of feedback from a lot of different people. And we wanted to be simple, but powerful and also hopeful, and really speak to what we were trying to do as an organization. And what we're trying to do is very simple. We want to build a better and brighter future for all those impacted by spina bifida. What that means is a lot of different things to a lot of different people, and we're trying to do a lot of different kinds of activities to do that. But one of the things that we're very focused on, of course, is health of people with spina bifida. The reason we do that is no one else is focused on that, only SBA. The fact of the matter is that, you know, there are a lot of disability groups that focus on disability rights, and we want to be a part of those fights. We want to be a voice at that table, but nobody is the voice of people with spina bifida and their health except the Spina Bifida Association. We're it. We're the only ones that really are focused on that, and focused like a laser in a lot of ways. So, but we have to realize that COVID-19 has had an impact on that, right? I mean, we're not together today, unfortunately, except virtually, and that's the only way we can be because of it. But it hasn't changed our mission. We look at those efforts that we're now engaged in around COVID-19 as a part of building a better and brighter future for people with spina bifida and the people who care for them. Our staff is 100% virtual at this point in time. We have been for well over a month, for almost 6 weeks now. But we are 100% committed to the community and to keeping it connected during these times. You know, the fact of the matter is we've always had a pretty connected staff. We've always been working virtually in some way or another. So we were set for something like this to happen. We've been using Zoom for quite some time. We've been doing webinars. So those weren't new to us. So we've just had to learn to adapt a little bit, and we're not used to not seeing one another, but we see each other through Zoom, and that's helped a whole lot. So one of the few things that we did when we first started was we got something up on our website right away. There's a link to it on this slide. Please feel free to copy that down and use it. We change it periodically, and we date it every time we make an update to it, so you know it's when it was the most up to date. It houses a lot of different references and resources on a lot of different topics, so that if you're a specific topic you're interested in, you can navigate to that topic and find the resources right away. And we update and vet that information every time we get a good source of information on anything pertaining to this. We've also sent out updates to our database periodically, and we continue to do that as more information comes about or as we learn more things. We've also used social media a lot to try to widely broadcast broadcast those messages because that's an important way to get the message out for people too. We've moved all of our events virtual at this point in time, like today's day. We're looking at education days, walk and rolls, happy hours, check-ins, and even chapter events through webinars and virtual events. The other things that we've done around COVID-19, we've held several webinars. The first one was Spina Bifida and COVID-19. That was on March 26th. And we had over 800 people who signed up for that, and over, I think over 200 people, almost 250 people actually were on the webinar. We answered a lot of questions. We had a ton of questions. We probably had about 90 questions, couldn't get to all of them. And so we have answered those, gotten those up on the website. The second one was, how is coronavirus affecting your mental health? That was on April 9th. We had over 100 people registered for that. And the last one was held earlier last week on the 22nd, is how can I help my child with Spina Bifida learn at home? That was held in conjunction with our Spina Bifida Association in Northeast New York chapter. And there were lots of people on that. Julie Indra did it, and it was also broadcast on Facebook, although we were having some trouble streaming it for some reason. So we tried to figure out what the cause of that was, and we're trying to get that fixed. There's another one coming up on this Wednesday that's a part 2 on the learning, and then followed on Thursday by one on knowing your rights around COVID-19 and disability. So we hope that people will take advantage of those and sign up for those. The other one that we have identified of doing is how parents and caregivers can take care of themselves. That's one we're working on. We don't have a date for it yet, but we will shortly, and as soon as we do, we'll notify everyone of that. We have some additional plans too. One of the things we want to do is poll our social media followers to gain some insights into what emerging needs are and any additional topics for webinars are. We're also looking at how people like to get information. Are webinars the best way to do it, or should there be other ways to do so? So we're looking at written materials to put on our website, as well as additional webinars, short videos, all of the different kinds of ways that we can get information out, and trying to get mobilized to do that. We know video isn't always the best way for everyone to learn, so we're trying to think about alternate ways to get information out to people. So that's our COVID-19 response thus far. We continue to adapt as we learn more and try to get information out to everyone. But there is still other work going on, and work related to the Spina Bifida Association strategic plan, which has been up on our website for some time now, and I hope that folks have taken advantage and taken a look at it. But if you haven't, we're going to talk a little bit about that here. Before we get started, I wanted to talk a little bit about what we utilized as our guiding principles when developing our strategic plan, and they were pretty simple. We wanted to make sure that we were transparent, and we wanted to make sure that we used data to drive our direction, and we wanted the involvement of the Spina Bifida community in everything that we did. So those were the 3 things that we looked at, and where they all intersected right in the middle, that was our sweet spot, and that's what became our strategic plan. So this is the first goal that we had. We lead research to enhance the quality of life for people living with Spina Bifida. How we do this is create a research agenda, support translational research, augment research and study requests, and conduct research and summarize research. Last year, you may remember that we had a survey that went out around research, and things that I think it was phrased basically, what impacts your daily life the most? And there were a series of about 44 questions. They were based on topics that came out of the healthcare guidelines gaps that we had done. And we used the information out of that to kind of categorize and to try to determine what was the most important out of all of those 200, 300 questions that are left unanswered. so that we could try to narrow down on the things that really mattered to people within our community to create a research agenda. So from that, we actually created a research advisory council that's comprised of about 18 different people. Some of them are clinicians, some of them are parents, some of them are adults with spina bifida. It's just a multitude of a lot of different people who have some experience and interest in research that have come together and created working groups on the different topics that were identified out of that survey. Right now, we're in the process of developing questions that we'll bring back out to the community and get some input into. And from that, we will create a research agenda. That research agenda we will then disseminate widely, and we will try to find researchers who are interested in finding answers to those questions, because we feel like those are the questions that are most important to you, and because they're the most, and they also need to be answered because we don't know how to take care of people in those areas. And so that's how the research agenda plays into it, and that's what we're in the process of doing. When we talk about translational research, that's, you know, all the research that comes out, how does that really relate to the care of people with spina bifida and to improving their health? And any subject that matters or topic that even remotely comes into that, we will continue to support efforts around that by, you know, clinical trials if need be, and finding people to be a part of them, or if it involves trying to develop studies of some sort and tests, then we'd like to be a part of that too. Any studies and research that are going on in the community, we try to augment. If it's good science and if it's answering questions that matter to our folks, then we definitely want to be at the table and help to make sure that you all are involved in those efforts. We do conduct our own research. Like I mentioned, that one survey that we did last year around our research topics, but we have others. There's one coming up here shortly that we hope to launch on catheters and insurance coverage. And what we want to do is take that information and summarize it, and then not only that, but also try to make sure that we are getting that message out to everybody within the community, so people are aware of what the most current research is. Clinical care is our next topic that we spend a lot of time on, and again, through the Collaborative Care Network, we improve clinical care for people living with spina bifida. We do that through our work with clinics and healthcare providers, again, translational research, outcomes work, transition support, adult care, and partnership. So we spend a lot of time trying to make sure that our clinicians are getting the most up-to-date information so that they can be in the know about anything that's coming up or has come up in research that could actually change how they practice and take care of people. We've also spent a lot of time bringing clinicians together. You know that we did the clinical care meeting now, but the fact of the matter is we do a lot of other work that's not in a big meeting with smaller groups of clinicians. Translational research, a lot of that has to do with our guidelines and making sure that they're being understood and implemented in the way that they should be, and then changing those guidelines as need be. We're in the middle of right now starting to look at some of the guidelines that were done and do new lit searches to see how things might have changed, and they will be updated before long. Around outcomes, then that's our work with the National Spina Bifida Patient Registry. What we're trying to do right now is to determine the clinics that have outcomes at the top end of the spectrum and those that are at the lower end of the spectrum, and try to figure out what the differences are to see if we can determine what it is that makes outcomes better in one clinic versus another, and how we can bring all the clinics up to that better standing so that we're getting the best outcomes for the individuals in clinics as possible. We do a lot around transition support. We're working with AAP and CDC on a project around transition right now from pediatric clinical care to adult care. That's a big piece of what we're trying to do, and if we can answer that question, then a lot of kids today won't have the problems that a lot of our adults today have in finding someone who can care for them. And we haven't forgotten about the adults who are here. We continue to try to develop plans and partnerships that can help us to answer some questions about how our adults can get care. We're in the process right now of doing some work with the physiatry group to see if maybe we can get them interested in learning more about our adults with spina bifida and trying to make them perhaps a hub that adults can go to get care. And then we also make sure that we are staying connected to all those professional societies that are out there in the topical areas related to spina bifida, and to make sure that we're building on shared education and advocacy priorities that are out there that benefit both the physicians and the people that we serve. The next area of our strategic plan is education and support. We empower members of the spina bifida community with information and support to improve the quality of their life. And we do that through 3 resources that we have. Our information and support, most of you know Juanita Panliner. She is our National Resource Center manager, and she does a great job in terms of answering lots of questions that come her way. Some are easy, some are very difficult. But she's the voice on the other end of the phone that a lot of people turn to when they have questions and they need to get answers. And let me tell you, she's like a dog with a bone. She's going to make sure she gets the answers for people if there's one out there to be had. Through our education efforts, things like our education days, our webinars, our SBUs, all of those things, all the information that we put on our website, all of that falls into our education and information support categories. We spend a lot of time on those right now. We're starting to review all of our information sheets based on the guidelines and trying to make sure that those are up to date. And so more and more of that will be changing over time. Network building is our next area. We serve as a hub to connect our chapters, clinics, and the broader community to improve the quality of life of people living with spina bifida. And we do that really through 2 simple means, our chapters and our communications. So we have some chapters that are doing some amazing things out there. And, you know, I mentioned earlier that we had the webinar on Wednesday in conjunction with the SBA of Northeast New York. And you know, it was really kind of comical how that happened, but it turned out to be a really good strategy. We reached out to Julie and she said, "Oh, I'm already doing one, and it's for the Northeast New York chapter." And so we reached out to the chapter and said, "Well, we were thinking about doing one too, so why don't we try to just coordinate this?" And so we did, and it worked out really well, and we're glad to do that. But we're hoping that we can do more of that because our chapters are really important to us because they really help us to understand what's going on in the local level, because they are the people who are the closest to individuals with spina bifida and see more of them than we ever could. And so the fact of the matter is, without them, you know, there is a missing piece of the pie for us. And so we spend a lot of time working with our chapters, trying to make sure that we're communicating with them, they're communicating with us, and that we're also taking advantage of opportunities that come our way. We also spend a lot of time in our communications efforts. You know, when you look at the efforts that we put forth in the last few years, they've changed dramatically, and a lot of that is because we're trying to spend a lot more time telling everyone exactly what SBA is doing, because for a long time we just kept doing and not talking about it, and people never knew exactly what was going on. And so our efforts have really been to use social media to broadcast what we're doing, but to also through, you know, written messages do that, video messages, all kinds of different ways. And so we're trying to make sure, you know, recently we just updated our website, trying to make sure that our website, you know, was giving the best information that we possibly could. It gets a lot of traction, a lot of people view it and go on it for a lot of different things, to including downloading all those information sheets that I was talking about earlier. But the reality is we can always improve those. And so if there are ways in which we can communicate that we're not, that would be helpful, please feel free to reach out and let Nora know, because we're always looking for ways that we might be able to improve, and we want to make sure that we are communicating with everyone as best we possibly can. Advocacy is probably my favorite thing. You guys know that. We advocate for positive change to issues impacting the lives of people living with spina bifida. The fact of the matter is, if you don't speak up, you're not going to be heard and things won't change. And so we want to speak up, we want to be heard, and we want things to change. And we concentrate on a few things in order to try to advocate on behalf of people with spina bifida. Number one is appropriations. And we'll talk a lot about appropriations today, but let's just suffice it to say that without, no money, no mission. Well, that's true when it comes to research and everything else. If there's no money at the federal government, at CDC, the National Spina Bifida program goes away, and so does the registry. And there's been too much energy and effort put into that, too much good data in there, that we don't want to lose that momentum. And so appropriations is key to ensuring that we continue to keep that program alive and well. Teal on the Hill. While we'd rather be doing this in person today, the fact of the matter is, here we all are virtually. We can still have our voices be heard, and we're going to do that. But Teal on the Hill takes a little bit of our time to put together, to put all the meetings together, to do all the legwork to get ready for people to go in and meet with people, whether it be by phone call or in person. It takes a little bit. So we have a whole strategy around that. We also have a strategy around grassroots advocacy, and that's one click you guys will hear about later today, but we use a particular software that allows us to get the message out quickly and allows us to get into the congressional offices very quickly with a very succinct message, but one that is still heard and matters. And on all different kinds of topics, and something like that, we can get rolling pretty quickly and get a lot of people engaged. And we're always on the lookout for those kinds of activities. We do it also through advocacy coalitions. The fact of the matter is, I'm on so many different coalitions, and so are Sheila and other people on our staff, that it's been a significant portion of our time doing that. But we do that because we want to make sure that the voice at the table hears about spina bifida, is talking about spina bifida, so that you all aren't left out in any of those activities that go on. I'll give you a good, for instance, we're part of an organization called the ITEM Coalition. Now this coalition really started out around Medicare and Medicaid advocacy, but it's broadened to include more about medical devices, particularly around Medicare and Medicaid, but medical devices per se. And we used to just be a part of that coalition, and we'd sign on to letters every once in a while. But this year I was asked to be on the steering committee for that coalition. And in doing so, now that survey that I was talking about with catheters, it's not only going to be done in the spina bifida community, but it will be done in other organizations as well too, so that we can see how big of an issue this truly is. And then we can start to try to, as a group, come up with some strategies to address this. And last but not least is state advocacy. The fact of the matter is, a lot of work needs to be done at the state level. This is a new area for us. Will and Megan are working on some plans around this with the advocacy committee. And so we're hoping next year we might have an update to give you all to kind of help you understand what our plans are in state advocacy. So that is yet to come, but it will be coming. We also look at physical health for the organization. We want to make sure that we raise money from diverse streams, and we manage our financial resources very, very carefully. We do that through physical oversight in all of our development efforts. Things like walk and roll, our mid-year and end-of-the-year appeal, all of those things help us to make sure that we have enough money in the bank to pay the people so that we can do the work that's done. And then the last goal that we have is around people in operations. And it really talks about aligning all of our human, business, and operational resources to achieve our strategies. And we do this through 3 groups of people. The first is our staff, the second is our board, and the last but not least is our volunteers. And I'd just like to say that we have really put in place efforts to try to include more volunteers in everything that we do these days. We are, as I like to say, opening up the tent to everybody. We really want people involved in the things we do. By being a part of Teal on the Hill, you're volunteering. You're giving of your time and your energy and your effort, and that's important. Without volunteers, we could not exist. We depend on them for everything that we do, and we just couldn't do it without them. I'd like to thank, and I just wanted to put up there for everyone to see, this is our leadership team. Mike Hardy is our chair. Nicole is our immediate past chair. Maria is our chair-elect. Currently, we are in the process of looking for our treasurer. And then Marie Toming, who is the Field Relations Committee chair, is our executive committee member at large. Of course, my name, Sheila's, and Glenn Ray's. All of the 3 of us are up on our website. You can reach us at any point in time. And I'd like to thank the rest of our board members as well, too, because they give of their time. Our advisors, Tim Bry, we couldn't do half of what we do in the medical field without Tim. And then Stephanie, who is a legal counsel that advises us. But I'd really like to say thank you to each of you and to all of the volunteers. April is Volunteer Appreciation Month. And I think it's really important for folks to know that we do appreciate all of our volunteers. We couldn't do what we do without them. You help make things happen. So thank you very much. And with that, I will go to the Q&A and see if there's some questions that should be answered. We've got about 5 minutes, I believe, if I'm not mistaken. Kim has asked a question about our national convention. We are not planning on resuming the national convention. It was not feasible from a standpoint financially to continue that. We have put our efforts into Teal on the Hill. We hope that at some point in time, Teal on the Hill will have as many participants as the national conference did. We build enough time when we are face-to-face in Teal on the Hill for people to have some time to do networking and be a part of groups, but we are not planning on resuming the national convention. But please, if you're interested in something like that next year, do sign up for Teal on the Hill. Hopefully it will be in person next year. And it's a great time to come and connect with your community and your friends and do something really positive as well. Question on how do we sign up for the webinars? When you get a link, when you get an e-blast, there's typically a link that says sign up. You can also navigate to our website and check it out. It's usually on one of the pages, and you can usually find a link from there as well too. There's a question around COVID-19 that I will hang on to, and we will see if we can get you an answer, Cindy, later on around that. From Greg, there's a question, is there a blog or a chat room sponsored by SBA for those with spina bifida? There's not a chat room, there is a blog, and if you're interested in receiving that, talk to Nora Henley, nhenley@sbaa.org. She can tell you how to get signed up for that. How can I participate in research at my local chapter? First of all, research typically is not done at the local chapter, it's done at the national level. So I'm not really sure what you're asking, but if you're interested in signing up for research, then I would suggest that you sign up for our updates and stay tuned, because when we have any research available, we're a part of things, any research studies, then we'll be letting people know that way. And which universities, it's an interesting one, which universities and hospitals have a dedicated department for researching spina bifida? far as I know, none of them have a dedicated department, but there are certain institutions, most of whom are involved in the National Spina Bifida Patient Registry, that spend a great deal of time doing research on spina bifida. They're a great place to start. But as to my knowledge, there's not any dedicated departments researching spina bifida. You will find it in various departments because spina bifida doesn't have just a singular impact. It doesn't live in a singular place. We find that problem with the National Institutes of Health too, because trying to find out where to start on issues around neurogenic bowel has been really interesting. There's a lot of finger pointing that goes on. It's like everybody else is doing it, I'm not doing it, and nobody's doing it. So we're trying to get to the bottom of that. And then there's a question, is the Research Advisory Council something we can get involved in voluntarily, or is it an appointed team? No, that we put out a call and took applications. And so it was based on who applied and based on what their interests were and what their experience was. And if it's something that you're interested in, you can certainly reach out to Judy Thibodeau, and she can put you on the list for the next time we're looking for candidates. Another question around DNA testing. Is there some correlation study or data being used to see if there's something in common with either the parents or those affected with spina bifida? There was a study going on. We have not had the results of it as of yet that I'm aware. That was actually looking, it was a saliva test if I'm not mistaken, and they were looking at trying to find some similarities to see if they could narrow it down to a gene or anything else. But to my knowledge, there's not anything else going on that we're aware of yet, but that does not mean that it would not be coming. And if so, when people reach out to us for studies like that, we typically, after they're vetted, then we will actually get that out through our update or an e-blast or on social media so that people can be aware of it. So we would always like to try to make sure that those kinds of things are getting out in the community so we can try to get those kinds of answers. All right, and with that, there's a question about SBA and Kaiser hospitals. I would suggest you reach out, Gregory, to Judy Thibodeau. She can talk with you a little bit about Kaiser and our relationship. And then there was a question from somebody who said that they had to drop off. Yes, if you do, you can come back on. If not, you will get a link to the full presentation later on, probably tomorrow. What groups are part of the advocacy coalition? So it depends on what advocacy coalition you're talking about. So some of the coalitions that we're on, I mentioned the item, we're also a part of NORD and several other rare condition organizations. We've been on the coalition of concern of citizens with disabilities. We're part of the National Health Council. There are a lot of different groups that we're a part of that we're doing advocacy with. So without some more information, it's really hard for me to answer that question beyond that. As far as starting grassroots organizations, if you're interested in something like that, I'd recommend that you first talk with Christy Wass, who is our director of chapters and walks. She can probably talk with you a little bit about what our plans are around that. And there's a question about incidence of spina bifida versus other disabling birth defects. We are the most common permanently disabling birth defect that is compatible with life. So we're it in terms of the most complex. And I'm not sure the incidence in comparison to other groups. But, you know, MS versus spina bifida is comparing apples to oranges because there are a lot more people with MS than there are people with spina bifida. And it's not a birth defect where spina bifida is. So that's not a fair comparison. Plus, the way the organizations were started is totally different. It's just a total different ball of wax for us versus an organization that has a sudden onset of a condition later in life. It's just, you can't compare the two. I think the closest comparison would be Downs to us, perhaps. And even that's not a fair comparison. As far as the catheter survey and signing up for that, when we're ready to go live with that, then you will receive information about that through eBlast and social media. And no, there is not a list of neurosurgeons that don't run away from adults with spina bifida, unfortunately. We are working with the Hydrocephalus Association to try to get to the root bottom cause of why we can't get neurosurgeons to do that. I think we know the answer to it, but the fact of the matter is that neurosurgeons only want to see you when things are bad and not really any other time. I'm sorry, Robin, that I said that, but adult neurosurgeons, I should say. So anyway, the fact of the matter is that is an issue that we're aware of. We're trying to figure out some answers to that one. It's a tough nut to crack, but we continue to work with the Hydrocephalus Association to see if we can do that.